A few Republican-led states already require employers to accept natural immunity as a substitute for a vaccine or weekly testing requirements. Wisconsin Republicans want to be one of them, as Naomi Coles explains. Naomi?
One thing to note before we get to the bill, it's opposed by several of the state's medical organizations, and the only medical person speaking in support of it today practices a type of natural medicine that isn't licensed in Wisconsin or many other states.
Or Omicron or Delta.
Debates in the state legislature today over a bill that would require employers to accept proof of natural immunity for COVID-19 in lieu of a vaccine or weekly testing requirement. Florida, West Virginia, and Arkansas have all already passed similar bills requiring employers to accept things like antibody tests as a vaccine substitute.
It seems to me that this bill is taking our health care out of the hands of the medical professionals and putting it into legislators who don't have a medical background.
Republican lawmakers turned to a naturopathic doctor for support, who said people were contacting his clinic in distress because of losing or worrying about losing their jobs because they won't get the vaccine.
Wisconsin does not recognize my license. I am licensed in the state of Washington. I'm not an epidemiologist and I'm not an infectious disease specialist, but I would be happy to answer any questions.
We asked an epidemiologist.
There is no test that can tell somebody whether or not they are protected from getting COVID in the future.
Antibody tests only measure for what you had. And while having COVID does give people a level of immunity, that level varies more than with vaccinated immunity.
Some people don't get a lot of protection at all, and those are the individuals who had mild illness, which is most people. When illness is severe and you survive it, you can come away with some protection that can last you a longer period of time. What has been clear, though, is that when somebody's vaccinated, they more reliably get protective immunity, and it lasts longer.
Now, one thing epidemiologist A.J. Sethi says can't be discounted is that the type of immunity you get when you have COVID-19 and then also get the vaccine is just so far above what you get from either one of those things on its own.